Hey, let me discuss with you the investigation of choice for all gallbladder pathologies. Firstly, just remember a single word, that is Umesh. So U means USG, M in Umesh is MRCP, E means ERCP, S means sensitivity, H means HIDA scan. So the initial investigation you will do for every patient will be ultrasound, and next step you will do is MRCP, and next step you will do is ERCP. ERCP is gold standard. When you call a investigation of gold standard is when it has both treating with diagnostic power, then you will say it as an gold standard. Now for biliary leak, you have to remember what is the initial investigation, what is investigation of choice, what is gold standard, and what is sensitive investigation. So just remember the letter Umesh. Initial will be U, investigation of choice will be M, gold standard will be ERCP, sensitivity S is HIDA scan. Thus you will get all the letters U, M, E, S and H. Now second disease, just remember for gallbladder stones you have to remember HUG, mnemonic. What is this? U means ultrasound. So initial investigation will be ultrasound. For G means gallbladder conditions. But what is this H? The thing is gallbladder stones after many days it will cause cholecystitis. So cholecystitis due to gallbladder stones, you will diagnosis more accurately with HIDA scan. Thus I remembered as H, U and G HUG. So if they ask you what is the initial investigation of choice either for cholecystitis or for gallbladder stones, you mark as ultrasound. But for cholecystitis, if they ask most accurate or sensitivity is HIDA scan. Now whereas for CBD stones, again you have to remember our mnemonic Umesh. U means initial investigation of choice in CBD stones, M is the investigation of choice, and E is gold standard ERCP, because you can diagnose and treat in ERCP. So again Umesh will help to remember CBD stones, initial investigation of choice and gold standard. Now for biliary stricture, again you have to remember Umesh. What is this is in biliary stricture you have to remember initial will be again ultrasound, investigation of choice will be MRCP, and gold standard will be ERCP. But just you have to remember for distal stricture it is Umesh only, but for proximal conditions it is not Umesh, it is PM. Yes, PM. P means percutaneous cholangiogram, M means MRCP. As M is smaller and P is large investigation. So for investigation of choice you mark as P only, initial you mark as U only, but for gold standard you mark as P. Thus for distal conditions you will mark as Umesh only as usual, but for proximal conditions, that is P, you will mark as P. So PM. P means MRCP, which is investigation of choice. P means percutaneous cholangiogram, which is gold standard. Then we as we talked about PM, we want CM also. PM and CM. Now C means again cholangiogram, M means MRCP. So I remembered as for atresia means thin guy, cyst means fatty guy. Initially he is a thin guy, later he become fatty guy. So for thin is C and fat it is M. So investigation of choice will be cholangiogram for atresia and MRCP for cyst. Thin and fat, C and M for thin and fat, and later initial will always remain as a ultrasound only. See, for atresia you have to remember thin as C, and fatty cyst as M. So atresia it is cholangiogram, for cyst it is MRCP. Thus for gallbladder stone and cholecystitis mnemonic will be HUG. For biliary leak it will be Umesh. For biliary stricture I said Umesh for distal conditions, and just you have to change E with P for proximal conditions. For biliary atresia and cyst I said atresia is thin and cyst is fat, so thin and fat as C and M. C will be cholangiogram for atresia, and MRCP for cyst. Initial will remain as ultrasound only. For biliary stricture I said distal Umesh. For CBD stones I said Umesh.